My name is Carl Stewart. My single subject research project is going to be on the effect of Suboxone on medication assisted treatment on opiate addiction in a 19-year-old boy. His name is Kevin. As again, I mentioned, my name is Carl Stewart. Abstract. In this single subject study, I will be conducting individual therapy for a 19-year-old Kevin who has been experienced withdrawal side effect of heroin abuse for the past 12 months. Opioids or classical drugs are found in opioids, poppy plant, and typically known for euphoric effect. Opioid can be described as a medication or illicit street drugs, example heroin. This special research focuses on medication-assisted and non-medication-assisted treatment on heroin addiction. Opiate addiction is a public health crisis, as this is the leading cause of accidental death in the United States. Suboxone. Suboxone and individual therapy are utilized for detoxification from the opioid dependence. We will seek to compare the advantages and disadvantages of the use of methadone, Suboxone, and individual therapy for the treatment of opioid addiction. In conclusion, this research principle will show that medication-assisted treatment, I call MAT, combined behavior counseling, appear to be more effective in treating opioid addiction dependence. We have some keyword here at the end of the slides. So this is my abstract in a nutshell. The introduction. The purpose of medicated assisted treatment on Suboxone is to get Kevin to reduce his heroin abuse from 5 times a week to once per week until he is completely free from heroin use and abuse. Kevin will be given MAT and Suboxone treatment for the next 16 weeks to see if his opioid use increases or decreases over this period of time. This intervention is important because of the number of deaths occurring on a daily basis in small and big cities across the country. The number of deaths related to opioid overdose has more than quadrupled over the last 18 years. According to Massachusetts Department of Public Health, there are 375 opioid-related deaths in 2000 compared to 232 deaths in 2018. Medication-assisted treatment is a method used to treat opioid detoxification. And withdrawal. Buprenorphine, also known as Suboxone, and methadone are the most commonly presented drugs for MAT. McElrath 2008 study, methadone is a powerful painkiller that in effect alleviating withdrawal symptoms and reducing craving. Clinical studies have shown that high doses of methadone between 80 and 100 daily are more effective in curbing opioid use and keeping patients engaged and committed to the sobriety. Suboxone. Suboxone is an antidepressant developed to help treat opioid addiction. One of the benefits of Suboxone is that it can be prescribed by a physician, methadone in the other, and is often dispensed from a specialized clinic. As a study done by Bolt 2016 section in 2013 that showed those effects and the effectiveness of both method when it is administered through a specialized unit and administered through a doctor. Drugs can impact workplace performance, personal relationship, and economy on a whole. In 2017 alone, the total direct costs associated with opioid addiction come to $115 billion. Johnson 2019 stated that in his research proposal, the goal is to tailor the treatment goal to the need of the particular individual. While relapse is expected in recovery, the individual who has maintained the longest period of sobriety are involved in MAT since it includes counseling and behavior therapy, which again is stated in my statement at the beginning of my presentation, my introduction. That's why this was pretty much selected by me. This was a group project done last year, and I'm just continuing on it in terms of doing my single subject research. The reason why this combination is the most effective is because the particular narcotics help them focus, engage, and remain in the therapeutic component of their treatment. The psychosocial mental health problem requiring intervention. Biopsychosocial assessment was conducted by Kevin in home therapist, assessing to assess his functioning and daily drug intake. Results from the screening and DSM-5 show that Kevin was diagnosed with opioid dependence disorder. Kevin state that he's unable again in school or attend on a regular basis for the past 6 months due to his daily heroin use and abuse. When in school, Kevin struggles to stay awake and participate in daily school curriculum. Kevin stated that it's hard for him to function routinely and daily without use of heroin. There is history in his family. There's no history, I should say, in his family of substance abuse or use. He reported no past or present treatment intervention, but Kevin did, however, mention that when he has to not use heroin, it's hard for him to stay still and have coordinated judgment with distance and feel. Hypothesis or intervention question. What is the effectiveness of medication-assisted and Suboxone in treating opioid dependence? Kevin use of medication-assisted and Suboxone treatment will reduce his heroin use daily to at least once per week until he will no longer feel the need to use heroin. A review of the relevant studies done last year by my group and I showed that most people with opioid dependence have reduced their use when medication-assisted and Suboxone is used. Those individuals who participate in MAT and Suboxone are more likely to maintain the longest period of sobriety. In this single research presentation, the independent variables are medication-assisted and Suboxone treatment. The dependent variable are sobriety, relapse, and participation. Relapse is defined as a return to opioid use after a continued period of sobriety. Sobriety is defined as a continued abstinence from opioid use and abuse. Participation in the MAT program is defined as engaging in certified opioid treatment program that administers Suboxone. Describe the type of single subject approach to be used. The type of single subject approach to be used in this particular design is that of the AB design style, due to the fact that it's simple, easy to understand, and least complicated of the measurement design because there is one baseline measure and one intervention at any given time. This was selected because I wanted to see the effect of MAT and Suboxone and opioid dependence in Kevin on a daily/weekly basis for the next 16 weeks, which was the duration of this single subject design. If there's a reduction in Kevin opioid use before and during the intervention, therefore the intervention is successful. If Kevin opioid abuse increases during this time, the intervention has failed. Describe the kind of intervention to be utilized. Medication-assisted and Suboxone treatment will be used to help Kevin reduce his opioid use over the next 16 weeks. Medication-assisted treatment is a method used to treat opioid detoxification and withdrawal. Buprenorphine, also known as Suboxone and methadone, are the most commonly prescribed drugs from MAT, as explained by McElroy 2000. Methadone is a powerful painkiller that's used to show the higher doses between 80 and cc. Describe the type of intervention. This is a qualitative study that will utilize questionnaires and Kevin opioid use on a daily basis. The information will then be interpreted over the next 16-week period. For the next 16 weeks, Kevin will be given MAT and Suboxone to see what kind of effects such intervention have on his opioid use. After the 16 weeks, this data will be analyzed to see if there is decrease of opioid abuse from 5 times per day to once per week until opioid use is stopped completely. Measuring and instrumentation. I have defined dependent variable of sobriety, which is an observable behavior that can be observed by client functioning and behavior after using opioids, especially heroin. Kevin has been using opioids for the past 12 months, and it has been affecting his daily functioning and how he lives his life. My goal here is to document how often Kevin used opioid on a daily basis to determine the effectiveness of meth and Suboxone treating in lessening his use. When intervention is applied, if this opioid is opioid use increase, it's not effective, and if his opioid decrease over the next 16 weeks, treatment is effective. Kevin will be documenting how often he used on a daily basis for the next 16 weeks in a journal provided by the assistant social worker and the therapist. Applied intervention. Kevin reports to individual treatment group daily and do a check-in with his therapist, physician, and social worker. Any incident of opioid should be documented in his daily journal prior to getting meth and Suboxone. He was assessed for a side effect and a drug screen was done for opioid abuse. He was administered meth and Suboxone after he was screened. At the end of each week, Kevin opioid abuse compared to his prior use. The anticipated outcome was measurable because looking to reduce his opioid abuse from 5 times to once per week within a 16-week period. To replicate this study, the participants should have a diagnosis with opioid-dependent disorder and the symptomatic for at least 6 months. The reported opioid-dependent disorder must be measured in terms of how often use opioid a day or a week. The research should be quantitative, where numerical data obtained can be analyzed for Kevin weekly progress over the period of 16 weeks of the effectiveness of meth, Suboxone treatment, and opioid dependency. This is my graph here. It shows my baseline and it shows my intervention. As you can see, my baseline is steady. As a baseline is what pretty much we start the data with. And from there, we're gonna compare between the fifth and the 6th week. There was a gap where we're splitting the baseline from the intervention to show that the progress that was made during that time. So within the 6th week, I should say, according to this graph, there has been improvement in Kevin frequency of opioid use and abuse, where there is progress, there's reduction in it, and then there is a drop at the 10th week, and then from the 10th week on to the 16th weeks, pretty much Kevin was stabilized in terms of his opioid use. So he hasn't been using, and that's what the graph is detailing on this slide here. Describe the challenges to intervention and the threat to internal validity of the outcome. The duration was only 16 weeks of treatment, and no follow-up was done. Follow-up is always good, especially when you're doing research, because you want to see the after effect, the prior, in between, and after the intervention was given, to see if it's still effective after they get out the study. It was a small sample size, as you know, because it's a simple subject. It's not huge. Normally done on one individual, one group or so when we talk about single subject design. Kevin quitting before the research end, that can be a challenge to the intervention. And attrition, being truthful with this information and honest. Summary conclusion recommendation. Kevin opioid use will be reduced from 5 to less than once per week in the intervention phase. The outcome was as expected, with Kavin opioid use decreasing after 2 weeks of intervention of the MAT and Suboxone use. It can be stated that the intervention given has helped Kavin reduce his opioid dependence are used during this 16-week period. MAT and Suboxone research has been proven to be more effective to treating opioid addiction. MAT and Suboxone treatment has great effect on limiting relaxing opioid addictive individuals. This is just a reference page. As I say, this is a continuation from last year group presentation that was done on the effect of methadone treatment versus Suboxone treatment versus medication-assisted treatment, opioid dependency. That was a comparison of outcome research that was done by my group and I. Again, these are my references where information was gathered, data was gathered and analyzed by myself, and my reference continue. But in total summation, I think the single subject research or single subject design is an important tool in building on empirical data and giving us information to work with in the future, so we can make respectable and productive decision on situation and an individual and family and children. So that's it. Hopefully it's good enough. All right, have a good day.